Okay, so in this video, I'll be telling you 6 causes of vaginal wetness during sex. Vaginal wetness is a natural response of the body that makes sexual activity comfortable and pleasurable. And there are 6 common causes of vaginal wetness during intercourse. Number 1 is sexual arousal. So when you are sexually aroused during foreplay, blood flow to the pelvic area increases, and this causes the cervix and the Bartholin's gland to secrete a fluid, and that fluid acts as a lubricant during sexual intercourse. This is just your body's way of preparing for penetration during foreplay or even after foreplay. You might be wondering where the Bartholin's gland is located. Well, it is located on each side of the vaginal opening, and it is a normal event because this fluid aids easy entrance of the penis inside the vagina, and also it aids easy flow of the sperm inside the vagina to the fallopian tube and ease egg fertilization. Number 2 is hormonal changes. A woman's body is regulated by hormones, and throughout your menstrual cycle, your hormonal levels tend to fluctuate. Higher level of estrogen, especially during ovulation period, can increase the amount of lubrication, or better still, vaginal fluid, which is wetness. Also, certain periods like pregnancy can also increase the amount of estrogen and even the vaginal wetness. But as a woman ages, estrogen levels tend to decrease, and this is why you hear women in their menopausal phase experience dryness of vagina. Number 3 is emotional connection and mental arousal. So when a lady is emotionally connected to her partner, her arousal level is heightened, and also this can cause increased lubrication, which is known as vaginal wetness. Number 4 is ovulation. During ovulation, a woman's body is designed to have excessive of estrogen, thereby causing vaginal wetness or vaginal lubrication to be increased. Even it makes them yearn for a man's attention or make them want a man around them. That is another way of our body telling her, oh, we are ready for fertilization, we have matured eggs ready to be fertilized, and we need a sperm to come in and fertilize these eggs. But when there are no sperm coming in to fertilize those eggs, the matured eggs are now transformed into menstruation. Number 5 is infection. I know this is not something you wanted to hear, but yes, infection. Some infections can actually heighten your vaginal wetness. An example of it is bacterial vaginosis, which is also known as BV. So one of the signs and symptoms of BV is having a discharge that is usually white, gray in color. Then also it is like thin or watery in texture, and most importantly, it has a fishy odor. It is also very noticeable during and after sexual activity and even during menstruation. So this can be caused by a change in the natural bacteria in the vagina. We know the bacteria in the vagina are 2 types, the good ones and the bad ones, and sometimes semen can alter the pH of the vagina, and once that pH is being altered, the bad bacteria tends to thrive in that area, causing odors and discharges. So it is important that once you notice any change away from the norm, make sure you talk with your healthcare provider so they can tackle that issue immediately, so you don't start giving that man bacterial vaginosis to feast on, thinking you are all wet and dripping down there. Number 6 is certain foods and hydration. I can't overemphasize this enough. Staying hydrated will keep you juicy, smell nice, taste nice, and also keep you dripping down there. So staying hydrated and consuming a healthy diet containing vitamins and omega-3 fatty acids can promote overall vaginal wellness. And these foods include avocados, fish, and even nuts. Number 7 is birth control and medication. So certain birth control pills like hormonal contraceptives, especially the ones containing estrogen, can make you wet down there. Additionally, medications like antihistamines or antidepressants will cause you dryness. So please, if that medication is not prescribed for you, stay away from it. So in summary, vaginal wetness during sexual activity is a healthy response of your body influenced by sexual arousal, hormonal changes, emotional connection, ovulation, infection, diet and hydration, and certain medication. So as usual, I would always say, if you notice any change in your body or in your vagina that is away from the norm, please do well to contact your healthcare provider, not any random person you feel like it's been. A licensed medical professional, please, so they can track down that issue for you. So I hope this video has brought about a bit of understanding to this topic, because someone dropped this question in my comments and I just thought to make this video for more clarity. So please, if you like this video, ensure you share it with your friends and family. Do well to subscribe, like, and if you're a returning subscriber, my guy, how far? And if you are not yet subscribed to this channel, I'll repeat it again, please subscribe to this channel and binge watch all my previous health related videos. You'd love it here. And with that being said, I'll see you in my next video. Bye guys.
I don't want pull no trigger. I just want me, cause I can play. I don't want no wahala, no wahala, no wahala, no wahala.